Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio with our morning media update. Thanks for being with us this morning. We have some special guests with us today. We have special guests all the time, but today's guests are pretty darn special. I've known both of them for a long time, especially this older guy here over here to my left, Roy Judson. He and I go back a long, long way.
Who still has his hair, by the way.
Man. Oh, he starts early and often and goes low on the very first
Shots
shot.
fired.
Man, Judson. I was about to say we've been through a lot of battles together. We have similar scars, and he goes for my hair length. Thanks, RJ. We'll get back to that. Which one of us is older, I wonder? Doc Hawk is here with us again this morning, Hawk Guy, and he'll give us our morning update around how things are going here at KU. And Jamie Wagner, one of our outstanding breast cancer surgery physicians and the leader of our breast cancer surgery program. So first, welcome to you all. And I should say Roy is the director of the NCI Designated Cancer Program here at KU. Trying to achieve comprehensive status next time. How many days and how many hours?
492 days.
And how many hours? Come on, you're usually sharper than that, brother.
Well, the hours aren't as important anymore because the we don't mail those applications in.
Okay.
They're
electronically submitted.
So, yeah.
All right.
So we don't have to know when the FedEx box is
closing.
Those days are long gone.
Dana Hawkinson, how are you doing this morning?
Hi, we're good. You know, here at the health system, we have continued to have good numbers. We have 15 today. 7 of those patients are in the ICU. We've had some discharges as well, so which is good. And you know, yesterday we were talking about modeling and what's going to happen in the city and in the community once people start opening up and getting back. And we have some numbers and some projections. I think we'll keep those blinded and see what happens over the next 4 weeks and see who comes out with the right projections. Hopefully it will be on the lower side of the projections, though, than what some of our other docs were predicting that will happen in, say, the next 4 to 6 weeks.
Yeah, we had a meeting last evening and we were working on the modeling, and each of us came up with our number, what we think. We used our inpatient census we all, I think, anticipated some growth in the numbers, except one person said he thinks it's going to stay flat.
Yeah.
And I hope that he's right and we're wrong. That would be the best. So Roy, this is a difficult time for cancer patients. Talk to us a little bit about some of the impacts to cancer programs around the country from COVID-19 and to cancer patients in general.
Sure. Thanks, Steve. I appreciate you having me on. So the cancer programs have been pretty dramatically impacted across the nation. And obviously that impact has varied somewhat depending upon the local, for almost 2 decades now. And whether or not this crisis will precipitate an abrupt halt to that progress, well, we really don't know. But that's one of the things we're worried about.
We are concerned. And Dr. Wagner, out there in your area, especially with breast cancer surgery, that screening and preventive, that's just incredibly important. Talk to us a little bit about, has that slowed down from COVID-19?
It has slowed down, and that's actually something that, as Dr. Jensen was just mentioning, we've had a lot of concerns because we know that once screening mammography was implemented, we have seen a decrease in the death rate for breast cancer by 40%. So a lot of the concerns with the halting of screening in the recent weeks has been that we will start to see more locally advanced cancers, which require far more extensive treatments with unfortunate correlating low survival rates and higher risk of recurrence. In the last couple of weeks, we have been fortunate to slowly start to increase our screening again, and we're back to almost 50% of screening. And in the next couple of weeks, we have the opportunity with some very thoughtful approaches on maintaining physical distancing to continue to expand that further, because it's going to be very important that women get back to screening.
So what are some of those things that you're doing in the cancer program to help keep people safe from the fear of COVID-19?
Well, from starting with screening, since we were just discussing that, is the way we have really rolled out expanding those time points again. Instead of, for example, every 15 minutes, we're expanding them to every 30-minute appointments. We have people that are actually stationed throughout all of breast imaging to assure that we are appropriately sanitizing rooms after patients have been screened, as well as making sure that we're adhering to the workflows that have been put in place so that we can maintain the necessary physical distancing. Honestly, it's actually giving us a great opportunity that we've seen to further educate patients on COVID as well as cancer and screening needs. When we then move to the treatment areas, we're adhering very strictly to policies that we have implemented, to everybody that's coming into contact with patients to being wearing masks as well as eye protection. We are also doing this for our patients so that all patients that are coming into any of our cancer center locations are also wearing masks.
Yeah, it sounds like a lot of good measures. How long do you think before we can get back to, say, full capacity of doing mammograms and other forms of breast cancer screening?
Well, our hope right now is that sometime in June we will be getting back to those almost pre-COVID levels. So really we're taking it 1 week at a time. If all the measures that we have currently put in place that we'll be rolling out over the next 2 weeks are successful, I think that we will be able to achieve it by sometime in June.
I think one of the things patients are afraid of is that somehow they're going to come into a healthcare setting, and because they're going to either run into a patient or a person or something like that, they'll get SARS-CoV-2 and it'll lead to COVID-19. Dana, have we seen that transmission occur in the outpatient setting or in the inpatient setting? Have we seen anything where a place where we think we've infected a patient?
No, actually, we've had very good experience with patients and healthcare workers here in the health system with COVID-19 and transmission of SARS-CoV-2. And actually, we haven't had any employee-to-patient transmission. In addition, our healthcare workers, it seems that our healthcare worker positivity rate is certainly the same or even less than it is in the community.
Yeah, I think it's actually been a little, I don't want to say significantly less, but about half of what we think it may be in the community. Yeah. Jamie, what kind of questions are you getting from patients about safety and what they need to do?
A lot of it is what we're doing within the clinic areas to be able to maintain that physical distancing, which fortunately we are able to assure them that we have many strategic plans in place. I think a lot of it is actually coordinating of visits, which we very much understand because we want them to come out of their homes as few times as they really need to. So we have been very thoughtful, again, on how we are putting together those appointments so that they're not coming in one time maybe to get an image and then also to see a provider, because physical exams sometimes are still very, very important. We've been able to launch telehealth to do that initial visit so that we can approach their in-person visit much more strategically and maximize that time. So bringing them in one time to get all the imaging that they may need, as well as all of the provider visits, even coupling physicians like surgeons and medical oncologists. Honestly, it's really helping patients get that full picture of their diagnosis and treatment in a more efficient manner as well.
Yeah. Dr. Jensen, as you look around, I'm sure you've been in contact with programs around the country. Anything that cancer centers around the country are saying that patients should do, or special precautions being taken?
You know, I think that just following up on the discussion around safety, there's no entity, certainly in this area, that is more focused on the safety of the patients coming in than this place. And you know, came in this morning, every single person I saw in the halls wearing a mask. We've instituted a whole series of protocols and procedures to make sure that we minimize exposures as much as possible. And I'm really glad to hear that we continue with the fact that we have not seen a transmission of this disease from one of our personnel to.
And we work hard to look at that too, just to say we do contact tracing, do a lot of things to be sure. And also, we always say every morning now, we're saying we don't have a mask on because our distance is 7 feet and it's hard to hear us with masks on through the microphone. So we do try and maintain our social distancing in the studio to make sure that we keep each other safe and therefore our families safe at home too. Well, let's see if our media have questions out there. We usually turn to the media first and see if there's any questions from reporters. not hearing any. I do know that that there have been some questions about remdesivir, Dana, that have come in the last couple of days. Any thoughts about where we are with remdesivir? How many doses do we have? Have we given it? Any thoughts about the outcome related to it?
Yeah, we have given it to, I think, approximately 4 patients right now. We don't know the full outcomes of all those patients, just because we have so many different services and providers giving those to those patients. We do have the allocation from the federal government, which has come from the state to us, so we are working, and we are certainly, we just had a meeting right before this about really finalizing any criteria to really include the most amount of people that really need this drug so that we can give it to them. So we are working on that. We have given doses, and we continue to do that, and if we can certainly get more, we are always trying to get more here as well.
Are there any therapeutic advances that are on the horizon, perhaps?
You know, nothing else new that has a lot of promise. Certainly, we are all looking at the anti-inflammatory drugs, the monoclonal antibodies. These are most of the time used in cancer patients or blood cancers. These or autoimmune diseases as well. They help really just to decrease the immune system function. So those drugs and the remdesivir really are the main ones that we're using here and really have shown the most promise.
Yeah, we're pretty excited about some of those. And then the drug combinations. Can you address that for just a moment? Because we've seen some data out there about using different drugs in combination, A, and B. Would remdesivir be one of those drugs that could be used in combination?
Yeah. Certainly remdesivir hasn't been looked at in combination as some of these other drugs. There has been some other, the main one that came out a week or two ago was an interferon plus a ribavirin plus an HIV combination medicine. The data behind that is really not too good. We are continuing to look at that. That would be hard to give that combination as well, because even the interferons is hard on the body when you do give it. So we are continuing to look at that. Obviously, the hydroxychloroquine and the azithromycin has really been shown to not be effective in
their cancer journey.
Okay, is it safe to fly? I'm going to turn first to Dana. Dana, is it safe to fly at all right now?
You know, I think, again, right now, depending on where you're at and what area you're at, you may be at the lowest amount of circulating virus in the community, so there's that to consider.
So if you're going to fly, this would be the time to fly, as opposed to waiting for another month after people have been out and possibly passing SARS-CoV-2 from one to another.
Because I think, the overall amount of flyers is probably lower now.
Yeah. Of course, the flights are slow, are low. They sort of canceled so many flights.
In patients, because that is a lot different than just basic benchtop research. So you see an effect if you're just in the lab and it say, hey, I'm growing these cells in culture, I'm going to add this drug to it. Does it affect the viral growth? And it looks like it does. But then once you actually get to patients, that's the biggest step. And so far, we haven't found a lot of favorable evidence that these drugs that we're using for repurposing are really working to help improve patient outcomes.
You know, thinking about repurposing drugs, Roy, is something that the cancer program, and I know you've had a special...
That maybe we could try this in a clinical setting. So Scott Weir and all of the folks in his operation have really become national leaders.
Kind of do, together with Children's Mercy.
So it's a wide-ranging activity, and we've been able to actually move 5 KU drugs into the clinic in the last year and a half or so. So we're pretty.
That's a pretty big deal. Well, those are big home runs and great for patients too. Other questions out there today?
Yeah, this one might be also for Dr. Jensen. What is the HEROES research program I've heard about, and who is eligible?
I think the HERO study, there's probably more for the hydroxychloroquine, Dana.
Yep, so the HEROES study it's for, we're looking at prophylaxis using hydroxychloroquine against SARS-CoV-2. So again, prophylaxis means we're trying to protect you from getting the disease if you get infected with SARS-CoV-2. That is for healthcare workers because it seems like they are probably more exposed, or they know they have more exposure in treating COVID patients, and that is ongoing right now. And I believe it's heroesresearch.org. You can look it up, and you can apply if you're a healthcare worker, and they are still, I think, enrolling. So it's basically to say, if we give you hydroxychloroquine and we know that you're in contact with patients with COVID, or if you're a healthcare worker, will this protect you from getting the disease and protect you from all the other outcomes that come with the disease as well?
And there's like 15,000 people that needed
Yep.
to enroll in the study. Hopefully, our number of COVID-19 patients will continue to drop. As we reopen society, though, that's a risk. And we need to think about social behaviors and how well people are doing, and are they personally responsible once they get back out into society, because we're hopeful that that will continue to keep the curve bent. You know, the Kansas City metropolitan region and western Missouri, Kansas deserve a lot of credit for having done some great work in bending that curve and making healthcare safer, because they did help us bend the curve. And now we just have to keep the curve bent and not let it come back, because
from this process.
than I am, because he's older than I am. The hair loss he referenced earlier, I know what caused me to think about this in the conversation this morning, but you know, aim high in steering, keep your eyes moving, get the big picture, leave yourself an out. All of that is true about COVID as you go back into society. Keep looking around, make sure you keep in your distance, get the big picture of what's going on around you. Keep looking ahead. Don't get caught up with, I want to get out to a bar today, I want to get out to do that. Aim high in steering. Keep looking down the road and knowing that really what you're aiming for is to get past the next few months. We start getting vaccinations, we start getting effective therapy, when it's really safe to go back out and enjoy the rest of your life and all that your life can give you. And don't shortchange yourself for decisions that you make today that could have big repercussions. Still